Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode, I answered another question from one of our readers and clients, Robert. And the question last week was part 15 of My 68-year-old mother is in intensive care with gastric perforation and she's not waking up after the surgery. Will she need a tracheostomy? You can check out last week's episode by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer the next question in this series of questions from my client Robert, which are excerpts from email counseling and consulting sessions with me. And the question this week is part 16 of My 68-year-old mother is in intensive care with gastric perforation and she's not waking up after the surgery. Will she need a tracheostomy? You can also find previous questions from this series of questions answered by clicking on the links below this video, where I put links to all the other questions from Robert. And if you're watching this on YouTube, just click on the link below this video, and that'll get you to our website where you can access all the other episodes as well. So Robert continues with his mother's situation, and Robert writes, "Hi Patrick. Overall, the day ended on a neutral to positive note today. First, their plan is to do a platelet transfusion if the count drops below 20. The ICU attending doctor has the same theory that you had, that it's possible that the platelets are being impacted by the dialysis. He also thinks it could be a byproduct of the recent infections and antibiotics. Next, there is nothing new in the blood cultures. And also her blood pressure has been stable enough that they're going to attempt taking her off the vasopressors or inotropes tomorrow and see how she goes. Number 4, my mum's breathing has improved such that they are going to try and reduce the ventilator support provided, which I believe is at 50% oxygen, 12 of pressure support and 10 of PEEP right now, and her breathing rate was 20 to 24 for most of the night tonight. Number 5, given that enough time has passed and that she tolerated the GI procedure fine today, they're going to test the feeding tomorrow with the tube. The doctor tonight has the same position as you have. There is definitely benefit to getting her back on the feeding tube versus the intravenous feeding. Number 6, both the doctor and I witnessed my mum trying to move her lips a little bit today, as if trying to mouth some words, even though we couldn't make out what she was saying. The doctor said that since it wasn't sustained, it's not an official neurostatus improvement marker, but unofficially it's a good sign. Number 7, the nurse who's with my mum, or who has been with my mum for the last few days, who's very experienced, noted that her mental status seemed lighter today, i.e. less like she was on sedatives. Unofficial, but this is the third night in a row the nurse worked the night shift with my mum so she can make a relative comparison. Number 8, the doctor seemed more positive today than I've seen them in the last few days. Certainly my mum is not out of the woods yet, but I'll take that. Number 9, your point on getting a hematology expert on the case is a good one. We'll bring it up tomorrow. Based on past experience, it's unlikely they'll be able to do things before Monday. Things slow down on the weekend for the special teams like infectious disease. They're running a full blood count every 6 hours or so. Therefore, we'll get a sense for how the platelet count number is moving up or down over the course of the night. That's all I have for now. Many thanks from Rob. Now, before I get into my response, given that you're watching this or listening to this, if you want one-on-one counseling and consulting with me, if you want me to help you with your loved one's situation in intensive care, go and check out my counseling and consulting options on the top of the website. So here's my response. Hi Rob, thank you for your update. Please have a look at my comments now. So you're saying that overall the day ended on a neutral to positive notes. Well, as I mentioned before, your and your family's positive attitude is so important, and I can't stress this enough. Positivity, patience, and persistence is often half of the battle. Even if the outcome is not what you had hoped for, it still helps to stay positive. If I was in your position, no matter how difficult the situation appears to be, staying positive in the face of adversity is going to be important and helps you and your family, no matter the outcome. Next, you're saying that their plan is to do a platelet transfusion if the count drops below 20. The ICU attending doctor has the same theory that you had, that it's possible that the platelets are being impacted by the dialysis, and he also thinks it could be a byproduct of the recent infections and antibiotics. Well, Rob, I don't quite get why they are waiting for the platelet count to go so low before transfusing. The risk for bleeding remains very high. The only positive is that the dialysis machine is less likely to clot. In many cases, the dialysis machine filters can clot frequently and cause a lot of disruption during the process, because the filters need to be changed frequently when the blood is too thick or simply not thin enough. Next, you're also mentioning that nothing new has shown up in the blood cultures, and that's very encouraging, Rob. Next, you're saying that your mother's blood pressure has been stable enough that they're going to attempt taking her off the vasopressors and inotropes tomorrow and see how she does. That's very good news, Rob, although I wouldn't be too worried if they continue going at a low rate. As long as they keep removing fluids in high doses, often the inotropes or vasopressors, also known as blood pressure medication, are needed to support a low blood pressure caused by aggressively removing fluids. Now you're saying next, Rob, that your mother's breathing has improved such that they're going to try and reduce the ventilator support provided, which is at 50% oxygen, 12 of pressure support and 10 of PEEP right now, and her breathing rate was 20 to 24 for most of the night tonight. Well, Rob, 50% oxygen is still a fair bit. It should be less than 35% in order to consider ventilation weaning. Pressure support 12 and PEEP of 10 are fairly normal settings for a patient like your mother to be ventilated. There is nothing unusual there. 20 to 24 breaths per minute is a good rate, and it shows she's comfortable. Any breathing rate above 30 per minute would be of concern, and it could be a sign of discomfort and pain. On the other hand, a breathing rate less than 10 breaths per minute could be a sign of your mother being too sleepy and too sedated. Number 5, you're saying that given that enough time has passed and that she tolerated the GI procedure fine today, they're going to test the feeding tube tomorrow. The doctor tonight has the same position than you. There is benefit to getting her back on the feeding tube versus the intravenous feeding. Well, as I said before, Rob, the sooner they can get her back on the nasogastric feeds, the better it is from my perspective and experience. Number 6, you're saying that both the doctor and you witnessed your mum trying to move her lips a little bit today, as if trying to mouth some words. And the doctor said that since it was not sustained, it's not an official neurostatus improvement marker, but unofficially it's a good sign. Well, I totally agree with that, and I do believe that families are much better at assessing that their loved ones are doing what their loved ones are doing when they're waking up compared to intensive care teams. ICU teams tend to be too busy taking care of all the other stuff that needs to be managed, whereas a family member like you at the bedside has more time to look at what their loved ones are doing in detail. You witnessing and interpreting, I believe, is a good thing. You know your mother best, and if you feel she's doing more than yesterday or in recent days, keep looking for that. Number 7, you're saying that the very experienced nurse noted that your mother's mental status seems lighter today, i.e. she's less like she was on sedatives. It's unofficial, but this is the third night in a row the nurse has worked the night shift with my mum, so she can make a good and relative comparison. Again, Rob, this is another sign that she's slowly moving in the right direction of waking up. Number 8. You're saying that the doctors seem more positive today than you've seen them in the last few days. She's certainly not out of the woods yet, but I'll take that as well. Well, Rob, the doctors being positive is a great sign, and it's often a missing ingredient when we work with clients one-on-one. They often hire us because of so much negativity from the doctors. I'm glad to hear that they're positive. Number 9. Your point on getting a hematology expert on the case is a good one. We'll bring it up tomorrow. Based on past experience, it's unlikely they'll be able to do things before Monday. Things slow down on the weekend for the specialty teams like infectious disease or hematology. Well, Rob, if ICU can't find out what's happening in regards to the platelets, they definitely need to seek specialist advice, like from a hematologist. Now, you're also saying, Rob, that they're running a full blood count every 6 hours or so you'll get a sense for how the platelet count number is moving over the course of the night. Again, Rob, that's another sign that they're keeping a very close eye on what's happening, which shows their commitment at this stage. So I'm looking forward to your next update, Rob, and I'll talk to you then. And if you're watching this and your family member is in intensive care, have you ever considered how you can become the best advocate for your critically ill loved one? Make informed decisions, get peace of mind, control, power, and influence quickly whilst your loved one is critically ill in intensive care. Well, you get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision-making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions, or you can call me, find international phone numbers on our contacts tab. Also, check out our ebook section where you get more ebooks, videos, and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype, over the phone, or via email by clicking on the Counseling and Consulting tab on the top of the website. This is Patrick Hutzel from IntensiveCareHotline.com, and I'll see you again next week in another update.